what is a physiotherapist? What do we do, and what patients do we treat? Because there's a lot of people out there that don't actually know what physiotherapy people can do for you. So physiotherapy is a very broad spectrum of treatments that one can do, and you've got many different specialities within the field. So at university you start, it's a 4-year degree here in South Africa, and in the first 2 years you do full-on training on working on cadavers. You're working on the biomechanics of the human body, how it works. You're learning about the anatomy, you're learning about physiology and chemistry and physics and all these things that you need to know so that you can learn how to work with machines. So we've got electrotherapy, where it's you use a range of different types of machines to treat the patient. So you've got the shortwave therapy, you've got ultrasound, you've got interferential, you've got the nebulizer, you've got dry needling, you've got, there's many different equipments that one has to the disposal that you can use to treat patients. Now, the patients that we do treat range over so many different aspects. So you can take a patient that's had an acute injury, and a physiotherapist will see them in the hospital. So if they've been in ICU, the physiotherapist will be there to help them recover through ICU. So if they're on a ventilator, the physiotherapist will treat their lungs, and they will treat them with passive movements to make sure that their joints don't get stiff while they are in ICU, in a coma, for instance. As they improve and you're weaning them off the ventilator, the physiotherapist is still there. We help them rehabilitate their movement. So if you've had a spinal injury, the physiotherapist is there, does the rehabilitation with them. So you teach them how to mobilize in a wheelchair. You teach them how to move from a wheelchair to bed or a wheelchair to a toilet. The physiotherapist will teach them how to do passive movements. They will rehabilitate what movement they do have. So if they've got a slight muscle function in their upper arms, the physiotherapist will rehabilitate them so that they can use whatever muscles they have left after the injury, so that they can become functional. And the physio will also then educate the family on how to help the patient do their daily activities. That's one aspect. Physiotherapists are there for children. So if the children get lung conditions, pneumonias, sinus infections, the physiotherapist, there will be one that will go and treat the child in the hospital and treat them for their chest condition. So you'll see them percussing the chests, they will be steaming them with the nebulizer, they will be suctioning all the snot out of their nose, and they'll be taking samples to see what bugs the children have and why they're still sick and not recovering. Then you'll have a physiotherapist that will teach women how to breastfeed and what exercises they should do during their pregnancy, and how to look after the baby, and everything is included in the physio degree. And these physios all specialize once they've qualified. So we learn everything during the physiotherapy course, and then once you're qualified, you pick the area that you like best. So you've got women's care, health, you've even got incontinence. So after the pregnancy, if the woman suffers with incontinence, the physiotherapy will help that patient overcome the incontinence. There was a video I did on incontinence to tell you how to do that. So the physio will be there to teach you what you need to do to improve your pelvic floor and your core stability so that you can overcome that. So as you progress through the different stages, the physiotherapist will be there to guide you. So from acute, in the hospital, in the ICU, you've just had an accident, we're there to rehabilitate any fractures that have happened, arm fractures, leg fractures, knee fractures, total knee replacements, hip replacements, shoulder replacements, elbow replacements, rotator cuff repair, your golfer's elbow and your tennis elbow. We do all those. We do whiplash injuries, we do back injuries, we do compression injuries where you've had a spinal injury. We even do neuro treatments, so people that have had strokes or children that are born with cerebral palsy, you have a physio that specializes in that area to help you treat your child and show you what exercises you need to do on a regular basis. Even if you've had a child that's born with floppy baby syndrome, the physios are there to help you educate your baby or help you guide your baby through the normal milestones from birth all the way through to normal development. So the physio is there to guide you and to point out if there's problems. From there, you get the physios that work like myself in chronic pain. So people that have had accidents, that have been suffering for many, many years with chronic pain, you get the physios that specialize in that area. So those would be your fibromyalgia, your chronic fatigue, your polymyalgia or myalgia patients, your headaches, your back pain, your hip pain, your funny pains. Those are the physios work with all those patients. Then you get your different specialized physios that work with your sports injuries. So you've got your top athletes. You will see the physio on the side of the rugby field, cricket field, Olympics. Wherever there are sports players, you will find your physiotherapists that are there to guide the patients to full recovery after a sporting injury like a twisted ankle, a broken wrist, a torn calf, a torn hamstring, a torn buttock muscle. Wherever you're planning on tearing a muscle, the physios are there to rehabilitate you, and they will guide you from the beginning all the way through to the final rehabilitation process. We've even got physios that do the very, very end rehabilitation. So if your top performers are just wanting to improve their performance, physios are there to help them improve their performance, because we've learned everything from A to Z of the whole body, how it works, how the muscles work, how the nerves work, how everything works. So it's a very, very interesting field to work in. It's a very nice field to work in. I find it very interesting. You've got physios that work on skin, so your patients with acne or dermatitis or psoriasis or any of the skin conditions that you might be having. Physios that work with those conditions too. So it's a very nice field to be in. If you're thinking of doing physiotherapy, go shadow a physiotherapist and see what they're up to. And remember that if you don't like that specific physio's way of working, each person works very differently from what you're taught. So you get taught the basics about everything, and then with your own personal knowledge that you acquire through your own life experiences, you will then be governed down a specific road to do the specific physio that you do. And these are very, very vastly different how physios treat different patients. It's actually quite humorous to think about it. But there's not one physio that works the same, and not one physio that thinks the same, and all of them are good. So go find yourself a good physio, and you might not synergize with the one that you're working with, and that's okay. So find the one that you do synergize with, and then that's the physio that you work with and work through your problems with and take you to the next step. And they also know when to refer you on. So if you have a specific injury, the physios have been taught how to diagnose. So if you come and you've got a knee injury, for argument's sake, and you've hurt your knee but you don't quite know what's happened, the physio can do special knee tests and say to you, listen here, this is a little bit more complex for physiotherapy, you need to go see an orthopedic surgeon, you need to have this test done, that test done. And then they've usually got contacts with the orthopedic surgeons or the general specialists that you need to see, that they can then refer you to go and see those specialists. So yeah, it's a great field. I love my work. I love being a physiotherapist. I'm trying to do the best that I can in the physio field to educate as many people as I can. I've written a number of books to educate people. I love having students under me. I've had several students when I worked in the UK that I helped mold into physiotherapists and guide them along paths of that I like. So hopefully that seed is planted and they take it further from there. But no, it's a great field to be in, and it's a very important field, and we need more physios and more people out there to help others. So thanks for watching the video. Like my channel and subscribe. Send to other people. If you know anyone that's wanting to be a physio, let them watch this video. It gives them a good idea of what. I'm sure I've forgotten a number of other things that physios do. My apologies, but I think I've covered the best range of it. So have a wonderful day. Thanks.